I want to go over the proper way to do a hip hinge today. You do the hip hinge with a deadlift. You do the hip hinge during a squat as well. But from a physical therapist standpoint, I want to make sure that we're doing this movement correctly to help save your back. A lot of our patients are low back pain patients. Actually, 90% of visits to your primary care have been statted out as being for low back pain. So I want to be able to bring some value to everybody and really teach them how to do a proper hip hinge whenever they're doing a stiff-legged deadlift or a squat type activity. Now, if you've had back pain in the past, this movement, if you can do it correctly, is a great progression after you've had back pain to help build your glute max back up and to help build your hamstrings back up so that those muscles in that posterior portion of your body can really help to support your low back so those small low back muscles aren't doing all the work. I want my glute max, one of the biggest and strongest muscles on our bodies, to be able to do a majority of the work. So the first thing that I want you to think about, and I'm actually going to turn this opposite direction so that you can get a better view of what I mean by hip hinging. But the first thing that you want to do is you want to work on your transverse abdominis. So once I get into position, I'm going to have my feet about shoulder width apart. I'm actually going to have a slight bend in my knee. So my feet are shoulder width apart. I'm going to have a slight bend in my knee. I'm actually going to pull in to engage my core and engage my transverse abdominis. So I'm going to pull my belly button towards my spine, and I'm going to feel that transverse abdominis engage right down here, right in by my lower abdominal area. Now I'm going to take this bar here. It's just a little weighted bar. So I've got my knees bent, my feet shoulder width apart. I've pulled in on my transverse abdominis. I want to keep my neck in a neutral position so that when I squat down, I don't keep it up. It's going to stay even with my spine as if I had a broomstick going straight down my back like this right here as I come down and do this movement. So my knees are bent again, and when I start to come down, my neck is coming down as well, and I'm basically sticking my butt back. My back stays straight. I'm going to then push my hips forward until I'm back to neutral. So this is what that movement would look like if you had a bar or if you had dumbbells here on the sides. So I'd be here and here. My butt's going to come back. My head's going to come down. And as I start to come back up, how I'm going to initiate that is by actually pushing my hips forward. My butt goes back, my hip comes forward. Okay? Now a common mistake could be I would push my hips too far forward and I would bend backwards. That can put a lot of stress on that low back as well and cause actually more harm than good by strengthening those glute max muscles. I hope that you found this video valuable. If you need any more information, please feel free to like our page, visit our website, reply below. If you need any other information about low back pain or how to do a particular exercise, reach out to us. We'd be glad to be able to get you some more information.